Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. There are so many new and emerging specialties within healthcare, one can hardly keep up. Our guest in studio today is Dr. Silvia Morris. She received her MD from Georgetown University School of Medicine and her master's in public health from Johns Hopkins Bloomberg School of Public Health, a former assistant professor at Emory University School of Medicine. She is currently an independent healthcare consultant and a community health advocate. She's here today to discuss the specialties of hospitalist and nocturnist. How are you doing this afternoon, Dr. Morris?
I'm doing wonderful. Thanks for having me.
A hospitalist, our listening audience is primarily healthcare professionals, but let's talk about what exactly a hospitalist is, if you would.
So a hospitalist is a person that only works inpatient. So they're a physician, usually board certified in internal medicine, but it may also be family practice. Mm-hmm. We will get into the other types of hospitalists they are, but their primary scope of practice is within the hospital itself.
Okay. So within the hospital, they're not in other clinics or maybe the clinics that are associated with certain hospitals throughout the country. Is that correct, or am I incorrect in that?
The hospitalists are dedicated inpatient physicians.
To become a hospitalist as opposed to, I guess, just a regular MD, what type of training is required above and beyond just a regular medical degree? Or is that something that's required? Do you just call yourself a hospitalist because of your dedication to inpatient medicine?
No, certainly after medical school, you select a specialty training. Mm-hmm. And most hospitalists, if we're talking about adult medicine, are trained in internal medicine. They are also hospitalists that have been trained in family practice as well. Mm-hmm. And those are each 3-year residency programs. So then you finish those residency programs, and then you take an exam, you become board certified, mm-hmm. board willing, and then, you start working for either a group or as an individual or for an entity only in the inpatient setting.
Approximately how long has the specialty of hospitalist been in existence?
Well, definitely. Well, hospitalist, the term was actually coined by Dr. Robert Walker at UCSF, and that was in 1996. So that was the first time someone even mentioned that there was this entity or this person called a hospitalist. And then the Society of Hospital Medicine, it formally organized in 2003. So as a specialty, it is definitely a new specialty, mm-hmm. but the components, the people who actually do the work, those specialties obviously are much older when you talk about internal medicine or family practice or neurology or obstetrics or pediatrics. But the term itself is rather recent.
We're familiar with the perceived day-to-day operations in a hospital setting. We watch General Hospital, that sort of thing. So take us through the typical day of a hospitalist. You arrive at your location. What takes place?
Yeah, a hospitalist, there's a lot of variety. So let's just stick with someone who only takes care of adults. Mm-hmm. So an adult medicine hospitalist. So he or she will arrive obviously at the hospital, typically 7 or 8 o'clock in the morning, and they will receive what we call sign-out. So overnight, there were admissions to the particular service, mm-hmm. and then they have to start to take care of those patients that were admitted overnight, in addition to the patients that they obviously had taken care of the previous day. So when you think about kind of a typical day, all days are atypical. Certainly, you start out with a census, so a particular number of patients. You may also admit new patients during the day. You certainly will hopefully discharge some patients as well, because we always want to see our patients get better and go home, right? Mm-hmm, mm-hmm. And then there is a lot of what we call coordinating of care. Okay. So you're working with not only the nurses, so it might be the case manager who helps you figure out where the patient will be discharged safely. So do they need to go home? Do they need to go to a subacute rehab place? Mm-hmm. Do they need acute rehab? So you work with the nurses, you work with the pharmacists to figure out, oh, this patient, by the way, needs IV medication, intravenous medication when they're discharged. So how do we set that up? Certainly you work with the social worker because unfortunately, depending upon where you work, sometimes patients don't have homes to go back to, or they can't return to their own homes safely because there isn't enough support systems there. So the hospitalist works in a multidisciplinary way with lots of people within the hospital to take care of each individual patient.
So if I'm understanding correctly, the hospitalist is basically the liaison between the patient, the healthcare provider, and what needs to happen with this patient once they're, or to facilitate their release, what happens after release, or what needs to happen as they come into the hospital and go under a physician's care. Is that correct?
Liaison, I'm going to pick on that word a little bit.
Okay.
Certainly, hospitalists, we do direct care. So it's not as if we're just kind of talking to people in the hospital about the patient.
Okay.
You go and see the patient, you diagnose, you examine, you figure out what's the best specialist, that if in fact a specialist needs to see the patient in the hospital. If something acutely happens to the patient while they're in the hospital, which I know may sound strange to people, but sometimes unforeseen things happen, and you have to immediately drop what you're doing with a less acutely ill patient and move to the direct bedside for the patient that's in extremis, and then move forward from there. So liaison, I'm going to say more direct care and direct coordinator of care.
Much more hands-on than simply managing the activities, yeah?
Right, because if that was the case, we could do that from home, right?
Well, maybe not, Now, let's talk a bit about Nocturnist as well. Is this closely related to a hospitalist?
It is. The Nocturnist is the night owl sibling of the day hospitalist.
Okay.
And I'm particularly, I talk about this a lot because I was a Nocturnist for 7 or 8 years. And the Nocturnist holds a lot of things together at night because typically the staffing levels at night are less, not to the point where care is compromised, but certainly there isn't the same number of physicians in the hospital, but yet still the patients are there. And sometimes they do more than sleep, unfortunately. And then oftentimes new patients most often come in the middle of the night. If we could have everyone show up between 9 and 5 in the afternoon, we would be quite happy. But unfortunately, grandma gets sick at 3 in the morning, so the Nocturnist is there to admit patients at night. So think of a Nocturnist as a nighttime hospitalist.
And is there specialized training simply to be a nocturnist as opposed to, as you say, the daytime hospitalist, is, shift differentials, dealing with people, different personalities of people that work shift work, or maybe people that are involved in staggered shift? Are there different types of training for the nocturnist?
Actually, no sort of additional training to be a nocturnist, but certainly coming out of residency, you get used to being on call and having to, upon occasion, be up overnight. So it's much more akin to working, definitely you mentioned shift work, so working overnight and just making sure that you have a feel of what's going on your service, meaning the patients that you're immediately responsible for, and then also you're responsible for the patients who are whose doctors are not there. So figuring out all of that information and working closely with the emergency department because that's where most admissions come from, and then obviously working with other services who may need an internist or hospital medicine consult overnight for one of their patients. So it may be for general surgery, it may be for obstetrics and gynecology.
Dr. Morris, where can we go online to get a little bit more information about the specialties of hospitalist and nocturnist?
Well, I definitely would direct people to look up the Society of Hospital Medicine. Mm-hmm. That is the organization for roughly 44,000 hospitalists across the country. And then definitely even within your individual society, so whether it's internal medicine, there's lots of literature now on obstetrics, hospitalists, pediatric hospitalists, etc. So you can first start with the Society of Hospital Medicine, and then you can move to your particular specialty.
Great. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio talking with Dr. Silvia Morris. She's board certified by the American Board of Internal Medicine and the American Board of Holistic Medicine. Dr. Morris currently cares for hospitalized patients with a variety of conditions. Some of her areas of expertise include hospital medicine, preventive medicine, holistic medicine, and internal medicine, including chronic diseases such as heart disease, high blood pressure, and diabetes and obesity. She's been in studio with us today talking about the specialties of hospitalist and nocturnist. Hopefully you'll come back and speak with us in future segments, Dr. Morris.
I would love to.
Thank you. It's been a pleasure having you here with us. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.